I'm Dave Munday. I'm one of the lead professional officers that's based in the health sector team at Unite the Union. I'm currently in London, where I'm doing this presentation today. I'm usually based up in the northwest of England in Greater Manchester, and I know, like I say, I know some of the people on this call. I'm not going to go around and get everyone to introduce themselves because I think that'll cut into the time a little bit too much. Just to say that I am recording today's session, so if you don't want your voice to be on, don't say anything. If you do want to ask any questions, though, please feel free to type them into the chat box as I'm going through the presentation. I'm not planning on pausing for any questions during the slides because I think it could get, quite delayed in terms of making progress. But I'm very happy to take any questions or comments at the end of the presentation. And it's also great to see that Paul Smith's joined. Paul, if you want to give everyone a wave, he is the Unite representative on the job evaluation group. And it's great that he's been able to join us today. He's not going to join in doing the presentation, but he may well be able to answer any thorny, difficult questions at the end. So I've not warned him of that, but yeah, I'm sure he'll be able to help out with that. Uh, this is the first session that we're planning to do of sort of some updates on Agenda for Change. Depending on how today's session goes, it may be that we'll do a few more going forward, but we're really interested to get your feedback on how you felt it's gone. And I'll email everyone after just to ask if anyone's got any feedback or comments, including any subjects that you would like us to cover in the future. The one that we've picked for this first session, though, it may sound really dry, but actually, I'd argue it's a really, really important subject, and that's Annex 31. I'm just going to go on to the next slide, hopefully now. Yes, so just as a brief introduction to Annex 31, on the 1st of April this year, a new annex was added to the NHS Terms and Conditions of Service Handbook, relating to the requirements of the NHS Job Evaluation Scheme. The publication of this annex is one part of a programme of work asked for by trade unions and committed to by the government to restore confidence in and build local capacity to improve job evaluation practice across the NHS. And like I say, today we'll be looking at Annex 31 in great detail, and hopefully give you some ideas on how you could potentially use this locally in terms of your own job evaluation scheme progress. Just to kind of give a bit of context, not the last pay deal, but the pay deal before, it was highlighted that there was a number of issues that needed to be dealt with that were not directly sort of related to, pay, how much people got paid in terms of pay rises. One of the 10 things that was identified was that the job evaluation scheme needed to be looked at, not particularly to change it, although there are other negotiations going on at the moment that you may have seen in the press that are looking at those sort of bigger issues, but actually to say that the job evaluation scheme works, but one of the problems is its implementation. And actually, where it's falling down is that locally it's not being implemented in the right way. So this was very much to look at that. So why was Annex 31 introduced? To help to restore confidence in the NHS Job Evaluation Scheme, ultimately to ensure that there's equal pay for work of equal value, to support employers and trade unions in applying the job evaluation scheme correctly and consistently. And this annex is part of a wider body of work which the government committed to improve JE practice overall. And just to highlight another couple of examples that you'll be getting more information about over the next few months and year is mandatory data returns on job evaluation. Hopefully some of you are aware of that process because that has already started. And also a new digital JE system. So for those that are as old as me will remember when job evaluation was first brought in England, there was the cage system. It's kind of bringing in a new cage system for the new generation kind of thing. So another point about why was Annex 31 introduced, I'm sure you'll all recognise this gentleman, Wes Streeting, the Minister at the Department of Health and Social Care. And he's made some really helpful statements about job evaluation, and that has included this one. I want to be clear that my expectation is that the NHS JES is applied correctly and robustly throughout the whole of the NHS, underpinned by partnership working between employers and trade unions at a local level to ensure that all staff are paid correctly for the work they are asked to deliver. So if you face any pushback from local managers up to any sort of senior level, why is this work going on? Why is this happening? It's because Wes says it has to, really, really importantly. So now just to go on to the purpose of Annex 31. The requirements outlined in the annex are intended to support employers, staff, and trade unions in the operation of what is a contractual obligation and in managing the risk of pay inequalities by detailing the actions necessary to ensure proper application of the scheme. One of the things I probably should have said at the start is that my assumption is that you all have a good level of understanding about what the job evaluation scheme is, Agenda for Change is. I'm not going to go into detail about how the process works because my expectation is as Unite reps, you've already got that level. If not, feed that back to me, and that's another session that we can maybe do. And just to add that I do know that some of the regional officers have organised training across the country for reps to get a better base level understanding of the scheme. So employers are to ensure that their local policies and procedures are consistent with the requirements of this agreement and accord with the requirements of the NHS Job Evaluation Handbook and other guidance provided by the NHS Staff Council, JEG. I mentioned before, Paul is our rep on JEG. This agreement outlines the principles that underpin the NHS JES, and it details actions required and the rights and responsibilities of staff, their trade unions, and employers in the operation of the scheme. It provides clarity on key processes and operational issues, and this annex should be read in conjunction with the handbook. So there are a number of principles that are included in Annex 31. Just to highlight the headings of these, but we're going to go into more detail over the next few slides. Equality, fairness, consistency of approach to and application of the JES, partnership working and joint ownership of all JE activity, and transparency of approach and communications. So to look at the first of those, equality, we all know there's a legal requirement to ensure equal pay for work of equal value. And it's detailed in the Equality Act from 2010. The responsibility for compliance with the law sits with each individual employer and cannot be delegated. So whilst obviously I work on a national level and there's lots of work that goes into the scheme nationally, the responsibility for complying with the law doesn't sit with the NHS Staff Council, it sits with your own individual employers. And in line with this, the job evaluation scheme was designed to be fair and non-discriminatory. It's been tested legally. We know through Hartley, that happened a number of years ago, but it's only legally sound if it's applied according to the requirements outlined in the handbook. And these requirements should therefore be seen as a complete package of work. Deviation from any part of the scheme may lead to equal pay risk. So it's really important to remember that organisations can't say, oh, we like this bit of job evaluation and that bit of job evaluation, but this bit we're not so much a fan of, so we're going to ignore that bit. If you did that, then the scheme isn't robust. And like I say, one of the reasons for Annex 31 is because we're aware of examples of organisations and individuals of not following the scheme to the letter of how it's written. So in addition, all staff should have equitable access to the provisions of the scheme, regardless of protected characteristics or occupation. What we know is that some professions, just to give one example, nursing, it's highlighted that there does seem to be problems when we look at protected characteristics and the availability and access to Agenda for Change. And that is another area that we've been pushing for work to be done on and had some success on recently. So the next principle that we're just going to talk about is fairness. Again, a tenet of Agenda for Change. All staff have the right to be paid correctly for the work they're required to do, in addition to having access to the scheme as above. This includes staff understanding and having confidence in the operation of the JES. Staff have the right to a re-evaluation of their job where it's agreed that the requirements of the role have changed significantly. They also have the right for their job description for the role to be reviewed at least every 3 years. And the requirements of the JES should also be embedded in all workforce development, career pathway planning, and service redesign plans to ensure fair and consistent pay outcomes across staff groups. We're going to go into detail in a few slides' time as to what some of this means, but that's kind of the overall statement around fairness and the importance of it. So the next principle, consistency of approach to and application of the JES. So the JES, as we mentioned earlier, has contractual status with the same legal standing as other terms and conditions of service. Consequently, it's essential that all processes and procedures of the scheme, as described in the handbook, are followed consistently and that the guidance and advice issued by the NHS Staff Council is followed. In order to ensure the consistency of application, sufficient resource must be made available to operate the job evaluation scheme. And again, this is one of the things that we picked out in the non-pay work a couple of years ago. Again, the fact that we believe that the job evaluation scheme is robust, but its local applications can cause problems. And also the fact that we know in 2004, when it was kind of first getting implemented, there was an army of reps and management side colleagues who worked on the scheme. The number of people has fallen off over the intervening 20 plus years. And we know that there needs to be some kind of re-engagement and increase in the resource that's being used on job evaluation. And I'm sure you'll all have examples of locally where you feel this has fallen down. But hopefully with this renewed focus, that will improve. The principles, the next one, partnership working and joint ownership of all JE activity. So it's a shared responsibility held jointly by employees in the NHS and staff side trade unions. Therefore, locally, all JE processes should be undertaken in partnership, both by those trained in the job evaluation scheme, and that there are mechanisms in place to monitor, review, and document all JE activity on a regular basis. Again, we're aware of examples where this has fallen down, where decisions have been taken unilaterally by some employers. Some employers have offshored the responsibility for doing job evaluation to private companies, for example. And again, it's really important that we push back on that and we make sure that employers do move back to the place where partnership is a central tenet of the job evaluation scheme. Another principle, transparency of approach and communications. So nationally, all documentation relating to the operation of the JES is publicly available. At a local level, any job evaluation policy process document will be agreed in partnership, will accord with the NHS Job Evaluation Handbook and be promoted to all staff. So again, that real importance that things shouldn't be being done or written without that partnership approach locally. An employee should be able to say to their employer, how has my job been evaluated? Show me the paper trail. Show me the information that was provided to the panel that means that the decision was made, that was made. And we certainly face some pushback from trusts that insist that they don't need to do this. I had an example a while ago where encouraged a member to ask for their job evaluation outcome, the outcome of their match, and they were told that they wouldn't get it shared with them because the trust didn't believe that employee would know what it meant. Again, that's not a defense, that's not a reasonable argument to make. So the annex, after talking about principles, goes on to rights and responsibilities in the operation of the scheme. It covers a number of different people, or a number of different groups, sorry. It talks about the NHS Staff Council, which obviously has overall responsibility for the job evaluation scheme at a national level. It also talks about employers, line managers, and staff, and then also information about parties that are involved in the local negotiating committees, partnership forums, etc. I'm going to go into greater detail what all that means. So, NHS Staff Council, if you look at the first line, it has responsibility for the scheme and work in partnership. And it just highlights three of the areas that it does this. Consider feedback and intelligence on the operation of the JES to assess service-wide risk and take action as necessary. Maintain and update materials and resources for the NHS JES so that employers can effectively apply the scheme to assign jobs to pay bands, and agree any amendments or changes to the scheme should they be necessary. So that's the body that governs the scheme. It shouldn't be up to local organisations to decide that they don't quite like the JES and they're going to amend it in certain ways that are outside of the responsibilities and requirements in the handbook. To go on to the next group, employers. It's important to think that first line for each of these, that it kind of changes the kind of relationship. So employers, when we think about what's in the annex, it's that they should ensure that. So employers should ensure that they're aware of their legal requirements and manage their equal pay risk by ensuring the JES is operated correctly. Ultimately, where did job evaluation come from? It came from a situation where we knew that people were being paid unfairly, and it was creating the opportunities and the risks of employment tribunals for equal pay claims. Obviously, organisations want fair pay, but they certainly don't want to be facing claims for equal pay. There is an identifiable senior responsible officer for job evaluation with a reporting line to board level. Obviously, it'd be interesting to know if you all know who that person is in your own organisations. It shouldn't just be there is one, it should be that you know who they are. The board should receive a regular report on job evaluation, both application and outcomes, and issues are raised on the corporate risk register as appropriate. Responsibility for JE activity sits within a designated and resourced part of the HR people function, and that should include a JE lead for staff side as well as a JE lead for the employer. And again, these people should be known. Just to continue with employers should ensure that they work constructively with local trade unions to maintain sufficient staff side involvement in job evaluation, and that includes examples to identify new panelists, that time off is granted for staff to attend JE training and to sit on panels. And we were keen to emphasise in Annex 31 that JE panel work is not included in the normal facilities time reporting. It's an add-on that is, should be provided, not sort of taken from or, part of that facilities time reporting mechanism. Employers should ensure that there's mandated data returns are submitted as required. That the end-to-end process for determining pay banding is no longer than 12 weeks unless mutually agreed, and that doesn't include time taken for role holders and line managers to agree job information or job analysis questionnaires, and all JE panels, including consistency checking, are conducted in partnership. Again, really, really important point there. Just to divert off the presentation for a few seconds, I can see there's a few questions coming in, but I can't see what they are. I'm going to take questions at the end. I mentioned this at the beginning, just so I can make sure that I progress through the slides at a decent rate. If any questions are coming in up in your mind and you've not added them to the chat, please do add them as I'm talking. That'd be really, really helpful. So just thinking about another group that has responsibilities in the operation of the job evaluation scheme, line managers. So they are again expected to. That's the words that we used. They're expected to understand the requirements of the NHS Job Evaluation Scheme, both strategically and operationally. They're expected to release staff to undertake JE training and panel work. Expected to work with staff to keep the job descriptions for roles under their management up to date, relevant. Ideally, saying annually, but at least every 3 years, job descriptions should be reviewed. And also to make clear when job requirements are changing substantively and ensure they are reflected in job documentation. And this may be different to temporary activities provided to support career development. So again, one of the problems that we know has happened over the period of the job evaluation scheme is that job descriptions have not kept pace with the changes in jobs. And if that's not the case, we know that job evaluation outcomes are unsound. So it is really important that there's an element of the job, this element of job evaluation is kept up to date and is robust. Uh, yep. So next, the group that we're going to consider is staff, and we change the language here from responsibility to have the right to. So staff have the right to be paid correctly for the work they are required to do. They have the right to an up-to-date job description that reflects the full requirements of their role, and that it's reviewed at least every 3 years. Have a re-evaluation of their job where it's agreed the requirements of the role have changed significantly. Have sight of the job evaluation report for their job on request, and have the right to challenge the outcome of a panel within 3 months of a decision being communicated to them. So just to think about one last group, rights and responsibilities. This is all parties to to a joint negotiating committees, for partnership forums, etc. So they should receive reports on JE activity and performance, including training and resources, and also ensure that regular monitoring and review of local policies and procedures is undertaken to ensure compliance with the JE Handbook and to identify where and how policies can be improved. And then some more. Ensure that all staff have equity of access to the scheme. Ensure there's provision for staff to seek informed advice and support from trade union representatives, and ensure that there's an agreed dispute resolution process. For example, an agreed process when staff and their line manager cannot agree job documentation. Now, I've said lots of kind of words so far, and it may be that some people will be like, well, what does that bit mean? What does that bit mean? And what we did when we wrote Annex 31 was recognise that it would be helpful to provide some FAQs that went into a little bit more detail, but didn't kind of overcrowd the annex itself. So what we've got in the FAQs, which are available online, is 19 different points where we look at different issues that come up in Annex 31 in greater detail. I'm not going to read through each of them today. I've just put the kind of the question up on the screen. What you may want to do is have a quick read through them as I'm talking and just think about, are there any that you particularly want to discuss, in a question answer session that we're going to do in a minute. I've got another computer to the side that hopefully if you ask me, I can open it and we can have a look at it. But the other thing that you can do yourself is, in another screen on your desktop now, if you just Google Annex 31 AFC, it will bring up a news story that talked about the launch of this new annex on the 1st of April, and also goes into detail of the FAQs. And hopefully, what we've done is we've sort of provided information that clarifies any of the points that people might question about the annex itself. I think the other thing to mention with Annex 31, like I said before, it's come out of concerns that were raised by trade unions in terms of problems with progress or application of the scheme. What Annex 31 doesn't do is create any new policy, any new procedure. It doesn't create any new kind of element to job evaluation. All it does is it references important elements that need to be done. So if you didn't want to read Annex 31, an alternative would be read the rest of the agreement, because Annex 31 doesn't introduce, like I say, anything new. And if you read the rest of the agreement, you wouldn't read anything that's different to what Annex 31 says. But obviously, what we wanted to do was recognise the concerns of members, ask for it to be sort of highlighted where things were potentially going wrong in local areas, and provide, a much shorter kind of hit of information that reps can rely on, but also that you can demonstrate to line managers, more senior managers, HR, etc. Some of the elements of the scheme that we know people are getting wrong, but actually they need to improve on. Hopefully, you've all had a chance to read that. Just to say, I will share a copy of these slides after. But again, as in the way that Annex 31 is, is developed, this isn't saying anything different, anything more, or anything less than Annex 31 says itself. So, just wanted to kind of provide a quick summary of what we've gone over the last 28 minutes. Uh, Annex 31 aims to support correct and robust application of and confidence in the job evaluation scheme. It sets out the principles that underpin the NHS JES and details the rights and responsibilities of employees and staff in its operation. It outlines a number of specific requirements, including keeping job descriptions accurate and reviewed at least every 3 years, ensuring that there's sufficient capacity, resource, and awareness to operate the scheme correctly. Work to agree Annex 31 was led by the NHS Staff Council, and it's seen employer and trade union representatives work together in partnership to address this important issue. For Unite, that was me. So I've got a slide here for questions. What I'm going to do though is I'm going to stop sharing the presentation now, just so we can kind of more easily see each other. Just to say that I have been recording the presentation. I'm not going to share any of your images or any of your names on that recording, and I will plan to not include the question and answer session. Apart from potentially to put an FAQ out after today's session that says this question was answered and asked, and this is the answer to it.